How to avoid hair loss. Every strand of hair on your head has a lifespan between about 3 to 5 years. Hair follicles have a cycle of active growth, transition, and rest. Hair loss occurs when your hair's growth cycle is disrupted. Hair loss is most commonly caused by your genetics and becomes more common in men and women with age. The second most common cause is telogen effluvium. This condition occurs when more of your hair enters the rest cycle, during which it falls out. Telogen effluvium can be caused by medication side effects, other underlying health conditions. If you're experiencing hair loss that leads to bald spots, patchiness, or large clumps of hair coming out, you should see your primary healthcare doctor or a dermatologist for a diagnosis. Whether your hair loss is the result of a chronic or short-term health condition, you can take action to protect the hair you have. Keep reading for tips on keeping your hair healthy and strong. How to prevent hair loss and improve hair health. 1. Avoid hairstyles that pull on the hair. Hair is flexible, but research shows that your hair can only be stretched so much before becoming permanently damaged. Hairstyles like cornrows, tight braids, and ponytails can pull your hair away from your scalp and loosen the bond between your hair and scalp over time. 2. Avoid high-heat hairstyling tools. Using heat to style your hair leaves your hair follicle dehydrated and vulnerable to damage. Hair dryers, hair straighteners, and curling irons can all damage your hair over time by causing moisture in your hair shafts to expand. 3. Don't chemically treat or bleach your hair. Chemically treating hair with methods such as bleaching damages hair by splitting protein molecules called keratin. If you're concerned about hair loss, limit your use of dyes, highlights, peroxide treatments, and perms. 4. Use a shampoo that's mild and suited for your hair. The purpose of shampoo is to cleanse your hair of dirt and excess oil. Overwashing with shampoo can potentially harm your hair. Sulfate's trusted source and some other ingredients have been linked to frizz, scalp dryness, and fragile hair. There's no evidence that any specific ingredients in shampoo cause hair loss, but they might contribute to less than ideal hair health. If you notice your hair is overly dry or frizzy, try a shampoo that's as close to all natural as possible. Most shampoos for hair loss cost less than about $30 and aren't covered by insurance. 5. Use a soft brush made from natural fibers. Using a soft brush with fibers that are natural can potentially promote healthy oil levels on your hair. The keratin proteins in your hair are stacked like shingles on a roof, so brushing them gently in one direction, starting at the top and continuing through to the ends, can help smooth and condition your hair cuticle. Brushing hair daily can also help you avoid seeing hair clumps in your shower drain. 6. Try low-level light therapy. Low-level light therapy promotes cell growth and repair. It's a potentially effective trusted source treatment for male and female pattern baldness, the most common causes of hair loss in men and women. These genetic conditions cause a certain pattern of hair loss. For men, it starts at receding hairline or bald spot at the crown. For women, it's characterized by an overall thinning that often causes a wider part. The authors of a 2020 review of studies recommend exercising caution when interpreting the research behind low-level light therapy for hair loss since some studies have conflicting interests. Light therapy can be expensive and isn't covered with insurance. One Beverly Hills clinic estimates the yearly cost at $3,500 to $5,000. How to prevent hair loss in women. Hair loss in women is typically caused by genetic female pattern hair loss, androgenetic alopecia, Thyroid disease. Other hormonal conditions. About half of women trusted source experience some degree of female pattern hair loss before age 79. If you are losing your hair, your doctor may recommend some of the following treatments to prevent further hair loss: Rogaine, Monoxidil, Aldactone, Spironolactone, or other anti-androgen medications. Oral contraceptives. Iron supplements, especially if your hair loss is connected to anemia or heavy menstrual cycles. Women who have reached menopause may also consider hormone replacement therapy, HRT, as a way to treat their hair loss and other symptoms. HRT is often covered by insurance. One clinic in California estimates that HRT costs about $10 to $85 per month without insurance. How to prevent hair loss in men. Hair loss is more common in men than in women. According to the American Hair Loss Association, about 85% of men have thinning hair by the time they reach 50. Hair loss in men is typically caused by genetic male pattern hair loss. If you're concerned about hair loss, a doctor may recommend one or more of the following treatments: Rogaine, Monoxidil, Propecia or Proscar, finasteride. Follicular unit transplantation, FUT, a hair transplant with underlying tissue. Follicular unit extraction, FUE, a hair transplant with only follicles, no connection.